Okay, well, I will go ahead and start. Let me just say first that I am extremely excited to be here in this setting. This is a webinar series by the Center for Global Islamic Studies on COVID-19 and Muslim religiosity. And we have had wonderful speakers, and we keep getting fantastic insights from all of our speakers. And we are in for a treat today with Professor Cortney Hughes Rinker, whom I will introduce in a second. My name is Bassam Haddad. I am a faculty member at the Center for Global Islamic Studies, and I direct the program for Middle East and Islamic Studies. We are extremely excited today to have Professor Rinker with us. She will be addressing the us with a presentation on not only are we already here, you're all Muslim, Salam, brother, the Islamic nature of the new normal in COVID-19 and exposing the conflation of religion, race, and culture. The good thing about this title, besides that it's long and informative, is that it's also on the screen in case my intonation didn't specify the quotes that are in the title. And at this point, let me just say a few words about Dr. Rinker because we are not able to read the whole biography, which you can actually access on the website. Dr. Rinker is the director of the Global Affairs Program and associate professor in the Department of Sociology and Anthropology at George Mason University. Her latest book, Actively Dying: The Creation of Muslim Identities Through End of Life Care in the United States, is forthcoming with Routledge. Dr. Courtney Rinker will present for about 30 to 40 minutes, and then we will open the floor for Q&A and discussion with everyone through the Zoom app and Q&A fields. We will be able to continue for about 20 to 30 minutes. And we will also, before I continue, be recording the session. So I am instructed to inform you that this will actually be taking place. Another thing I would like to share with you is that this session, of course, is in a series of sessions, which means we are having another talk on November 4th with Dr. Anna Piella from Northwestern University and Joanna Clotofil from okay, this is going to be challenging, uh, Jagiellonian University. And the title of their presentation on November 4th at 1 p.m., also here on Zoom, is I've discovered I love to pray alone, in quotation marks, women's approaches to practicing Islam during the COVID-19 pandemic. So please try to be with us. And you can also access previous, as I understand it, previous presentations also on the website. So I will stop here. And again, it's my pleasure to introduce my colleague and dare say friend and speaker for today, Professor Courtney Rinker.
But thank you so much for that warm introduction. I'm going to share my screen, so I'm going to share my slide. So if I just need 1 second to do that. Let's see here. Okay, and then let me go to slideshow. Thank you so much for joining today. I'm really excited to be able to give this talk. It's something I'm thinking through, so I need to make an apology in advance if it's not exactly coherent, or maybe I haven't quite put the pieces together yet. And also, I just want to make a note too, is I'm going to be looking at some Twitter responses, and some of them are quite negative. So I just want to make that note in advance as well, for everyone. So here I start with the Preparedness 101 Zombie Pandemic, and it comes from the CDC, the Centers for Disease Control and Prevention, and particularly from the Center for Preparedness and Response. And if you go onto their website, they have this entire zombie preparedness kind of kit. And it's thinking about how leveraging this image of the zombie in order to become more prepared for natural disasters or even pandemics, which we are living in currently. And I don't want to go into too much detail. We just have to keep in mind that this image of the zombie has a long history connected to colonialism, the Atlantic slave trade. It certainly did not originate in Hollywood, as we typically think. It has a long history dating back to West and Central Africa. So I do just want to make sure that we're keeping that in mind as we're looking at this. And I'll just read a short quote from the anthropologist and writer Zora Neale Hurston from her book, Tell My Horse, about her work in Haiti and Jamaica. And some people have said that Tell My Horse is really a story of Hurston grappling with being voiceless, of really trying to find her voice at the time as someone from an underrepresented group, a minority in the US, and also as an anthropologist. And so she says, no one can stay in Haiti long without hearing zombies mentioned in one way or another. And the fear of this thing and all that it means seeps over the country like a ground current of cold air. This fear is real and deep. It is more like a group of fears. And so I open with this. I open with this idea of the zombie and looking at the graphic novel that the CDC has produced, in part because if we look at some of the different news sources, or even if we look at some of the literature, we're thinking about how COVID-19 might be similar to what we see in terms of a zombie attack. In that, when you think about zombie films and the zombie genre, sometimes we know who has been infected, right? Who is going through zombification. Sometimes we don't know. And it's also seen as kind of these zombies coming on to society as being these attackers. And people have likened kind of these films and this genre to the coronavirus, right? This attacker on society that has disrupted everyday life. We typically see in zombie films and books that there's kind of a retreat of the government, right? They kind of give up, and then because the zombies seem to take over society, and maybe we're living in that today. And so I want to think about this idea of kind of this attack on a society, and maybe we know it's coming and maybe we don't, to the quote and the tweet that I included partly in my talk title. And so this caught my attention. It went viral, this tweet, and it's from Johanna Buyan, who is a journalist. She's a 2013 graduate from Lehigh University in Pennsylvania. She's from New York originally. And one thing I would say is that this tweet went viral, and her next tweet was, "So you've made my tweet go viral, now do it to my article." And she does, as I wanted to say, started to say, was that this tweet went viral. And so encourage you to make her articles go viral, because she does some wonderful work on diversity and inclusion, particularly within the tech industry today. And just some really wonderful work that ties nicely into some of the initiatives we've seen here at Mason around social justice and anti-racism as well. So this tweet comes, her response comes to, and if you look at the one side of the screen, you can kind of see her profile there. And then you see who she's responding to, who is Neil Bortz, talk show host. He calls his podcast rude and offensive. And so his tweet was, "You think COVID-19 is bad? Give me a break. Wait until Muslims hit critical mass in America. You'll look back on these times fondly." And so again, this is kind of this lightening of this, right, this zombie attack, and kind of thinking about, on society. And she writes back, "Sweetie, everyone's already washing their hands 5+ times a day, covering their face, not shaking hands, and avoiding bars. Not only are we already here, you're all Muslim. Salam, brother." And so her response garnered various different reactions on Twitter. So these are some of them, one being clapping from Dwight Schrute from The Office. Someone wrote, "OMG laughing, thank you for this. Hashtag in this together, hashtag common ground." Another was the sassy ballerina gif that appeared, Obama's mic drop at the White House Correspondents' Dinner in 2016. And then also, speaking as an atheist, I have to say your response got me my first belly laugh in quite a while. Thank you, ma'am. And so as I was kind of, and I'm a medical anthropologist. And so I was really thinking about this in terms of kind of what I've seen in my own field work and my own research. And so I actually had the privilege of contributing a chapter to this book that came out in 2019 that was the result of a conference. And it's Treating the Body in Medicine and Religion, Jewish, Christian, and Islamic Perspectives. And I was in communication this summer with one of the co-editors, John Fitzgerald, who's at St. John's University. And he was saying, thinking about the chapter I wrote, because I wrote on how some of the very mundane aspects of the US healthcare system that we come in contact with every time we go to a doctor's office or a hospital or urgent care or wherever it may be, I've thought about how these aspects are actually kind of manifestations of Islamic principles and values. And so I just have a little quote here from the beginning of the chapter. It says, "My main objective in this chapter is to present qualitative data that highlight the underlying Islamic nature of medical practices that I discuss. I will show that for my participants, routine and practical aspects of the United States healthcare system are sites of religious meaning making. These are aspects with which patients engage most often across various spaces of care, from primary to specialized to acute. I suggest systematic practices are significant to my participants because they exemplify Islamic moral values of respecting others and taking care of bodies so that they remain healthy to return to health." And one of the aspects I looked at in particular was cleanliness. I looked at sterilizing instruments, and I looked at sanitizing. And it was so kind of thinking about that as how we're living today. Johanna's tweet really resonated with me and made me think a little deeper about some of the work that I had previously done. And so I want to, as I said, kind of in the talk's title, is I want to, and in the abstract is I want to think about how this new normal that we're living in intersects with Islamic principles as they are understood by participants who have been part of my ethnographic research, particularly here in the DC region. And so I have some examples that I want to share with you to kind of highlight this as to how we might think about kind of the underlying Islamic nature of some of these different ways we are living now, whether it's social distancing, whether it's face covering. And so I want to just share 4 vignettes with you from my research, and I'll try to make them short. But the first comes from an imam in Northern Virginia who discussed how washing hands and sterilizing instruments have a strong connections to Islamic principles of cleanliness. Um, Quote, "In Islam, God sees the importance of us Muslims being clean. So when doctors and nurses see their patients, they have to wash their hands and the things that they would use during the exam." Additionally, he referenced the need to wash bodies after death. "It's terrible when you have to cut the clothes from the body. I have been washing the dead bodies of Muslims for 10 years and shrouding them. I've seen all kinds of things." Now, that comes from research I had done a couple of years ago when I first started my project on end-of-life care and diverse Muslims' experiences with serious illness and end-of-life care here in the DC region. And then as I moved into a hospital where I actually conducted observations and field work, one thing I also took note of is what happens to the body after death, particularly what happens to the Muslim body after death in terms of burials. And I want to say that also an article that appeared in the Yale Daily News in 2019 talked about how secular regulations hinder Muslim burial practices. And this was in Connecticut, but we can also think about how that could also happen in other parts of the country. Washing of the body, a prominent requirement in Islam, can be difficult to do if death takes place in the hospital. So, when I was doing field work on end of life care among Muslim patients and families and healthcare providers, this was one concern that was raised as to what would happen to the body after death. Typically, the body and how it would operate in the hospital, that if a person died, they would need to do the proper documentation, they would need to clean the body, but then the body would be moved to the morgue rather quickly in order for the room to be prepared for the next patient. So there were discussions, particularly I remember one Muslim family who wanted members from the funeral home to come. And so the physician made arrangements that the body could stay, but could not stay in that room. So the body had to stay in a hallway until the individuals arrived to help with washing and preparing of the body. But additionally, burial is to take place within 24 hours of death. But the 24-hour burial is not in the Quran, but is a cultural practice from the faith's desire to respect the body and to avoid decay. So one thing I also want to think about, and I'll get this into a little later in my talk, is to how these practices, and we might see as being Islamic in nature, actually have very strong cultural and historical beginnings as well that also need to be considered. A third example is from a Muslim physician who was working at the hospital where I was conducting my research. And he facilitated a training session for medical residents. And I was there, I was able to observe the session and also conduct interviews. He highlighted the importance of cleanliness for Muslim patients and families. The session focused on how to provide services in religiously and culturally sensitive ways for Muslim patients, but as they receive palliative care or hospice care. Using ablution as an analogy, he stated that since Muslims must clean their bodies before prayers, it is equally important to wash hands before touching a patient and to make sure that instruments are sanitized properly. He explained that cleanliness is a critical part of daily life for Muslims and also how health has health benefits because it can prevent the spread of germs. And the fourth example that I wanted to provide comes from one of the Muslim chaplains that I worked with, and volunteer chaplain at the same hospital. And in our interview, she said she often incorporates prayers for cleanliness into her visits with Muslim patients and families because she has found it to be a concern for those whom she sees. She said, I pray for the doctors in making decisions. I pray for the nurses who are supposed to be compassionate and kind and clean and accurate and bring all these things um, and bring all these things up because people in the hospital are very worried about that stuff. When I asked her what she meant by cleanliness, she replied, you have to wash before you go in and out. You have to wash before you enter the room and then after you exit. Some people are really concerned about cleanliness. I mean, I've had Muslim friends who have caught diseases in the hospital because of unclean habits. And so I was going back to my field work and going back to my data. And as I was writing, and I was really thinking about how some of this had come up in my research pre-COVID, pre-pandemic. But then some of this had been heightened then during the pandemic because now we are thinking more about cleanliness and things like making sure we're washing our hands to prevent the spread of germs, prevent the spread of coronavirus, for instance. And so it really got me thinking about how these are intertwined and even heightened during our new normal, or maybe more prominent during the new normal that we seem to be living under in COVID-19, and not sure it will change anytime soon. So I want to go back to the tweet that I started with from Johanna Buyan. And I want to just go through some of the other responses that that she received, going from 5+ times a day is how many times I usually wash my hands by midday, and that's not enough. But then I want to go over to the quote that's on the larger panel, and from a user who said, my adopted way of avoiding handshakes as soon as this started was to place my hand over my chest. something I learned from interviewing an Islamic woman many years ago. Someone responded, St. Mary's of the Miraculous Medal told us to do the same. Cleanliness is next to godliness. Christians know this as well. And then someone wrote, then Christians need to recognize every time they go to church during this pandemic, infectious spread occurs, which will lead to more deaths. Please stop filling the pews. And then St. Mary's has been streaming mass for years. So yes, stay home. So we can think about, and this has been raised in some of the other lectures in this series about how, and it will be raised again on November 4th, about how actual religious practices have changed due to COVID-19. Now, some of them, the tweets, were questioning the response that she gave. One tweet was, that is disingenuous to reply to a racist tweet. Soap is not used in ablution, so it does not disinfect against viruses. Muslim men do not cover their face. Not shaking hands is antisocial behavior that only sanctioned during pandemic. And then someone responded, I'm going to go to the bottom. He said, debatable. I see it as a difference between forced actions versus precautionary actions. Since when is using a face mask or keeping personal hygiene a religious thing? And then someone also responded, man, that's a tough religion if the tenets match recommendations during a plague. So kind of these very kind of overgeneralizations about Islam in particular. And then there were some quite negative responses to the tweet, and also meeting in large numbers, hugging each other every day 5 times. Someone responded to try to correct, saying, actually, the mosques have closed for social distancing since the outbreak, but try again. And then someone responded, I don't find either one of these tweets amusing at all. The first 4 being racist. So something else I also want to mark right now is the use of the term about racism that's also coming out in these tweets, as I want to delve into that a little bit later. And the other isn't exactly my favorite. It's common knowledge where the large majority of Muslims want to breed us to 10 to 1 and want America to die as a nation. I mean, this is extremely negative and stereotyping. And then we can go on. Muslim countries don't give rights or citizenship. They run from the regime, citing oppression, and they force hijab or threaten others. America, then someone trying to correct, America is not a Christian country. We have no official religion. And then thank you. I'm so sick of hearing that fallacy about it being a Christian country when we actually have freedom of expression and freedom of religion. So I want to start and I'm still trying to pull this together as how I see the two as linked, but I do see the two as linked, is thinking about this Islamophobia, which I'm going to delve into a little bit later. I don't think completely captures the structural and institutional aspects of it. But the term Islamophobia or anti-Muslim bigotry or anti-Muslim racism can it be a form of racism? And maybe it needs to be, if we don't say it's a form of racism, and I'll talk a little bit more about that, can it be analyzed using a framework of racism? And so I want to kind of think about this idea of Islamophobia and racism. And I have just a few, again, I've really, for this talk and kind of how I've been thinking about this, I really kind of used my anthropological lens to do an analysis of media and public discourse and reports and such. But pulling a quote from Todd Green, who I know has written for Maidan, I believe, continue to look for the ways that some media outlets instrumentalize COVID-19 to heighten Islamophobia. And this was a tweet from The Economist. It was since taken down, but the story has not been taken down about radicalism in the Maldives, Islamic extremism in the Maldives, and particularly that it will be heightened during the time of COVID-19. And then going to Islamophobia and xenophobia, it is time to acknowledge and address xenophobia as in the United States. And so thinking about how these two are coming together. And thinking about how, can we start thinking about Islamophobia and racism, and how can we start thinking about them together? And there's literature out on this as well, and people have addressed this in different ways. One, I think, real prominent example that we can talk about is in what's happening in France. And so I have 2 clips here. The one comes from NPR. about, it's come from rough translation with Gregory Warner, and it's about the new normal, particularly in France under President Macron, who issued a decree that may not enter certain public spaces like schools or the metro without covering your face with a mask. There's a fine if you don't comply. But our correspondent in France, Eleanor Beardsley, brought to our attention a different French law that says, well, the opposite. The law actually says you cannot dissimulate your face, cover your face, conceal your face in public. And this, of course, goes back to some of the debates concerning the niqab occurring in different European countries, and France particularly is one. And so we have the fine. If you go and you listen to the whole talk or the whole show, it talks about how now you have 125 euro if you don't cover your face, but yet there's this law in place that you will be fined if you cover your face, right? And so then again, these debates, particularly around this idea of religion, and I really appreciate Farine Parvez's work on the politicization of Islam in France and also in her work in India, in thinking about the discrimination that Muslims face in France. Is it xenophobia? Is it Islamophobia? Is it racism? And she kind of tries to disentangle some of this in her work in Lyon. And then the French and Austrian governments passed bans on face masks in 2011 and 2017, respectively, meaning face coverings, as a way of targeting and criminalizing the wearing of the Muslim face veil, the niqab. Today, France's National Academy of Medicine is calling for masks to be made obligatory for anyone leaving their homes during the lockdown, while the Austrian government has made wearing face masks compulsory for anyone entering a supermarket or grocery store. And then going back to 2018, the Danish government insisted on making new citizens shake hands at their naturalization ceremonies, a move which, as the New York Times noted at the time, was aimed at Muslims to refuse on religious grounds to touch members of the opposite sex. And I'm also reminded here of Jeff Kacharian's work on Belgium and some of the culture tests. And so I want to kind of go just a little bit more recently. I'm sure many of you have read about the recent attack on a teacher at the Collège du Bois d'Aune in the Conflation Sainte-Honorine, the town of Conflation Sainte-Honorine in Val d'Oise, which is outside of Paris. And it was a teacher who was decapitated, basically, by a student. And it linked back to his discussions of the caricatures and the cartoons of the Prophet Muhammad. And they did the young man who was responsible was killed by the police shortly after the attack in the area. But this is, if you go on to YouTube, you can watch President Macron's response. He's outside the collège, where he talks about he says, in French, he says, la liberté d'expression, la liberté de croire ou pas de croire, about the freedom of expression, the freedom to believe or not believe. And so this is really interesting when we're thinking about what is now being required in France in particular, in terms of wearing face masks, of covering the face. But yet there was a fine before for covering the face. And now he's touting that there is this, freedom of expression, this freedom to, this freedom to believe or to not believe. And so I think, again, this is kind of thinking about how we might think about Islamophobia or what we call anti-Muslim racism, which is like anthropologists such as Lara Deeb has called for, is kind of much more institutional and structural than just this kind of individual bias. And this is maybe why Islamophobia is not maybe the correct term that we should be using, or to think about it a little bit more. So I want to delve into that and provide some examples also in my fieldwork, my more recent fieldwork on end-of-life care, as to how discussions of race, culture, and religion have become conflated with each other. And so I want to provide, before I kind of get into talking about race, racialization, and culture, I do want to give a couple examples where these have come together in my fieldwork. And so I want to talk first, just briefly, about a young man who I have named Ali to protect his identity. And Ali talked about his quote Islamic outlook to life in combination with growing up as a minority in the United States. He explained that he had an Islamic outlook to life, especially just growing up as a minority. And this was really interesting when it played out after Ali's father's death in the hospital. So his father was on life support for about a month before Ali made the decision to, along with his brother and his mother is a convert to Islam, and his father is originally from the Middle East, made the decision to remove his father from life support and to allow him pass away in the hospital. What had happened is that Ali was determined to have his father buried in his home city in the Middle East. And so he did not have his father buried within 24 hours here in the United States. His father's body was kept in the morgue for an extended period of time until travel arrangements could be made. At the time, I spoke to Ali a couple weeks or a month after his father's passing, and he did not make the trip yet. He was fully employed, and he needed to take time off of his job to do so. But part of why he wanted to do so was this connection to growing up as a minority here in the US. He talked about how he didn't feel this belonging religiously, culturally, racially. And so this really impacted the way he believed his Muslim identity. As Shaban Amir has argued, that Muslim identities are multifaceted. And so it also made him think about the decision of where to bury his father at the same time. I want to also raise a discussion I had with an imam who is on the East Coast. And he talked to me about his involvement in the protests after Freddie Gray's death in 2015 in Baltimore. And so I just want to read a little bit about our interview. He said, after Freddie Gray's death, demonstrators took to the streets to protest against excessive use of force. In early days, most of the protests were calm. Many carried banners, some of which read Black Lives Matter, an echo of similar protests around the country in recent months. The demonstrations escalated with rioting and looting after Freddie Gray's death. Imam Mahmoud, who I also use a pseudonym to protect his identity, stated that he, along with other members of interfaith organizations from the area, were heavily involved in the protests. He said he hit the ground running after Mr. Gray's death. They attempted to redirect the demonstrations after they intensified, trying to explain to individuals that the destruction of property was only, quote, hurting each other. It would not produce real social change. Imam Mahmoud explained that people respected him and other interfaith organization members rather than the police who he said had, quote, lost control. I was intrigued by Imam Mahmoud's discussions of the protests during our conversations and the fight against injustices in American society. The Imam has spoken out against hate and stressed that in Islam, as well as in other religions such as Christianity and Judaism, helping each other and showing love and compassion to all is of the utmost importance. He specifically has spoken out about accepting refugees and immigrants in the United States as they play a large role in American society. But unfortunately, the Imam recognizes that because they may not look or act, quote, American, they may face discrimination and violence. When he talked to me about his work at the hospital as a chaplain, he stated that if staff are not familiar with Islam, they may view practices or Muslim patients and families' decisions as, quote, strange. He sees Muslim patients at the hospital who immigrated to the United States or who had come to the country specifically seeking healthcare. He spoke of how Muslim patients and families sometimes just want him to come to the hospital room to pray with them. He said, sometimes it's just about being present. You don't even have to say anything. Sometimes that is more comforting to people, the fact that you have an imam in the room with you, just to talk to you or just to be there for you. They would just want you to sit there for a while. So I would just sit there. Sometimes presence is all that they need. So, from this, it almost seems like the patients and families needed an ally at the hospital who understood their point of view and would not raise judgment about their actions or choices. Underlying Imam Mahmoud's comments about the protest in response to Freddie Gray's death and about his work at the hospital as a Muslim chaplain was the recognition that minority groups in the United States, Blacks, people of color, indigenous, Muslims, and non European immigrants, for example, encounter injustices and biases on a regular basis. As an imam, he is to inspire people to speak out against inequalities that have become ingrained in American society, to strengthen the community through helping vulnerable and underrepresented groups, and to encourage everyone to show kindness and grace to each other. So he really linked his work in the hospital, and I really was intrigued by his idea of being an ally, of just sitting there and just being present. And he said sometimes that's all the patients and families need. And it was more about having someone there who understood their point of view. And he linked that to then his work in the protests about Black Lives Matter and about the structural and institutional racism that is here in the United States. And so I found this really interesting how he sees himself as being at the intersections of these as well. So I want to kind of think about that a little bit more. And in the commentary about thinking about Islamophobia and racism, we have to think about race and then racialization and culture. Coming from anthropology, race has been kind of disproven to be biological. There's no gene that particularly codes for skin color. It has Anthropologists have argued it is a social construct that has, it doesn't mean when it says it's social construct, that kind of means, well, it's not as real. Race is real. It is real in the social sense, and it is real that impacts people's everyday lives in very different ways. And so once we kind of see the fact, kind of this abandonment of this idea as race being a biological construct or scientific category, we kind of see this idea of racialization, which is problematic in itself, where then culture then becomes kind of this marker for race. And so when we think about early 20th century, even mid 20th century, and even more recently, when whites can no longer claim kind of this biological superiority, now we kind of go to culture and we think about this idea of civilization. So in itself is problematic, but then we see when there is this abandonment, kind of this idea of this scientific basis of race, of this biological basis of race, then we start to see how culture is then being invoked. And then we see this process of racialization of groups continuing. The one thing I want to bring up is that when we think about Islamophobia, I want to think about how it's not just these individual biases, but it's also it's structural and institutional. So it's structural and it's institutionalized. And we see this. And there has been some wonderful, more recent work about policies that look to counter extremism and counterterrorism. So I'm thinking about after the Christchurch bombing in New Zealand, for instance, the policy of prevent. And it's been written about that if you look at this policy, what it does is it really targets Muslim communities. So rather than being a solution to the problem, a solution to trying to figure out these injustices that have kind of become ingrained, they are now targeting targeting Muslim populations and Muslim communities. And so it's not really solving the problem, it's rather maybe not being, it's not the best solution, right, to it. And so really thinking about that is that it's not just this idea of this individual bias, but rather it's this very institutionalized structural process that has been legitimated over time. And so this is something else I want to think about, is what Frantz Fanon said, even in 1952, that it's the racist who creates the inferior, right? And so racism is neither seen as an individually held prejudice, nor is it a tool or instrument used by powerful social actors, but as a social structure that regulates social relationships in very specific ways. It uses symbolic markers to construct differences between social groups. And racialization is problematic in itself because it tries to kind of justify these approaches to explain cultural racism that is just an analogy to kind of this scientific, kind of this biological based racism. So one other thing is that we have to think about these intersections and these histories. So I think the Imam Mahmoud is a good example of this, of how we have these different intersections happening, where we have Islamophobia intersecting with Black Lives Matter and the police brutality against particularly Blacks in the United States. And so what we're starting to think about is that we can't particularly disentangle all of this sometimes, that we have to think about this together, and how these multiple forms of repression work among these different groups at the same time. And we dispute that Muslimness is constructed exclusively through these ideas of, we think about race as kind of skin color, kind of this outward appearance, and we want to kind of be very cautious in thinking about that Muslimness is also kind of this outward appearance, right? There's much more to it. And so in this case, we need to maybe rethink what racism is. Maybe a more broadly defined construct becomes very important. And one thing that I've taken from the literature is really thinking about this idea of legitimizing categories that become legitimized over time. So we see kind of these racial categories as becoming legitimized, first starting on kind of this science, right, and this very biological construct, to now kind of this cultural way of explaining difference. And so it's this process that these categories become legitimized. But then at the same time, we need to be careful, because thinking that there is a single identity, that there is a single Muslim identity, is very problematic. And thinking about how it is these factors, kind of in Ali's case, for instance, how he identified in terms of how he identified racially, ethnically, really also influenced how he thought of himself as a Muslim, and it impacted his experience. One thing he talked to me that was very important for him was that he was able to, a Muslim physician at the hospital is the one who cared for his father. This was after a referral from a non-Muslim physician who said, I think I have someone who can help you. And this doesn't always work, right? Because we always have to realize that not everyone who identifies the same way believes the same thing. But in this case, it did. Ali appreciated that this Muslim physician also grew up in the United States, grew up with part of an underrepresented group. And so he felt like he had this affinity to him, and he gave his advice and his medical opinions much more weight because of it. So thinking about these, how they all come together, is something I've been trying to grapple with a bit more. Something that's really stuck with me too, and going back to some of what's been written about policies, is this policing. And I heard a quote recently that made me think about how civility, it might be a way of policing people of color. And I found this to be very powerful in thinking about my own practice, even here at George Mason. And so we see, as I said before, as we look at these types of policies about counterterrorism, counter-extremism, we kind of see how they're actually a way of policing Muslim communities. I appreciate, go back always to Laila Abu-Lughod's work in post 9/11, and thinking about, do Muslim women really need saving? She said, if you look at Afghanistan, for instance, there's extreme poverty. There's people carrying guns everywhere. A lot of it is because of the US intervention and what's happened. And so she said, that's what we can do. That's the problem that we can solve, right? It's not just about, do Muslim women need saving? It's more about thinking about these international interventions. So, something I've been thinking about is these kind of, we think about these, what's been put in place here in terms of COVID-19, but then we also see similarities with these different policies that have really become way to police Muslim communities, particularly in non-Muslim majority countries. So I want to end, sorry, let me advance. I want to end here by going back to the tweet, and two responses that came out again was, what in the world does COVID-19 have to do with Muslims? It's a disease caused by a virus, and we all are susceptible worldwide, regardless of religion. What am I missing? That kind of goes back to the last point. And I think, again, I don't want to dwell too much in the French example, and thinking about President Macron's more recent comments, but I want to think about how some of these discussions and discourses around these around these restrictions, and how these restrictions really impact different communities differently, particularly thinking about those who have been marginalized or those who have been underrepresented in society. I think we can see that here in the US and even in Fairfax County. And then the second one I call to is we are sanitizing, kind of thinking about it's very problematic to have this single identity, or it's very problematic to assume that if you're Muslim, you're going to practice this particular way, right? Is that we are sanitizing hands with alcohol, which is haram. We are covering mouth and nose, not our hair or ankles. We are drinking alcohol at home. So just chill and stay safe, right? I also wanted to go back to a quote that came from a young man I interviewed as part of my field work in my very beginning stages on end of life care, that made it into the chapter in the book that I showed you. When we talked about kind of these mundane aspects, so he was talking about finding a primary care provider. And he said, I think he respected me. I didn't have to wait for hours to be seen. I only waited maybe 15 minutes, not bad. We Muslims are supposed to respect ourselves and each other. It's like not drinking alcohol because it can damage your body. You're supposed to respect God first, of course, but then each other. It's like this meeting. If I was late to the cafe, I wouldn't respect you. Or if you were late, you wouldn't respect me. God and Islam don't look on this well. It's the same thing with the doctor. But what I'll call your attention to here is the way he talked about not drinking alcohol. So part of what I think we need to consider are kind of these cultural and historical underpinnings as well of these practices that have become associated with Islam, is that you're thinking about, he said here, and one thing I want to note too is as an anthropologist, I'm not trying to have one moral framework for understanding Muslim experiences. I'm also not trying to say that there is this kind of ultimate truth. That's not what I'm trying to uncover, but rather I'm trying to uncover how people come to their own religious understandings. And as he's saying is that you're not supposed to drink alcohol because it's damage to your body. It's a bad thing to do to your body, right? And so kind of going back to these other quotes as to, well, what does COVID-19 have to do with religion? It's also thinking about how these different practices police bodies differently. And maybe that's a way we can think of how Islamophobia and racism are coming together and maybe even heightened during this time of COVID-19. So I want to stop there. I want to say thank you for listening to me. I'm not sure that was exactly coherent. That was probably to put the pieces together. It's something I've been thinking through and maybe raising some more questions that I need help answering rather than solutions. But I want to say thank you. I do want to give credit. This is actually a street painting coming from Dublin of the coronavirus, kind of abstract art that we're seeing rise across the US and the world in terms of COVID-19. So I want to say thank you very much. And I am more than open to any questions or comments or helpful to help me think through.
Thank you very much, Dr. Rinker, for this insightful and actually stimulating and interesting presentation. And I am really excited that we have the opportunity right now to engage with our um, uh, audience. And the way we're going to do it is two ways. Either you can raise your hand through the app, and I could call on you and you could unmute yourself and ask the question directly, or a much less exciting approach, which is typing the question in the chat box. So please feel free to indicate if you would like to raise your hand. We have a question from Chris Taylor. Um, is there anybody else so I could maybe accumulate two or three questions so I could have Dr. Rinker register them? Any other questions blowing? All right. Well, this is great. That's good enough. We
Yes,
could
sir, yeah.
start with Dr. Chris Taylor or Chris Taylor. I'm not sure what the prefix is, but please go ahead if you can unmute yourself. And then, Courtney, if you feel free to answer the question. And if there are other questions, also feel free to let me know if you would like to bundle them up. At this point, it seems that we have one question. Please go ahead.
Thank you.
Thanks so much. Yes, this is Chris Taylor here, a research scholar at this center, and have long really looked forward to hearing more about your work, Courtney, and the lecture today totally delivered. I have so many questions about some of the interesting details, but was thinking recently about your comments on Islamophobia being adjacent, not equated with racism, and how even if the word is not indexing systemic nature of racism as much as personal emotions like fear, what else that does for your research project, theoretically having that referent, looking at institutionalized racism and the lens of this, what we call Islamophobic tweet that you have at the center of your presentation. And some recent conversations looking to recenter discussions of systemic discrimination, especially racism, around whiteness and white supremacy, just kept coming to my mind. And I wanted to ask how much you see your project aligning with this newish theory striving to recenter studies of racism around white supremacy rather than the victim, if I may use that term, looking at the institutions supporting this type of systemic discrimination, especially in the case of Muslims, for example, with the links that you have with the zombie from Haitian voodoo and African origins and pandemic fears today, all through it, do gesture a lot to, in my mind, to whiteness and especially white settler colonialism as a corollary institution of global white supremacy. And the Friends Fanon quote gestures directly to this, right? But in a way that Negritude in the past unified various national efforts for abolition of minority rights. I wonder how much your project is looking towards today's sort of post 9/11 world, where arguably like the dichotomy of good, bad, Muslim, and to use Mamdani's phrase, is as much of a primary way that these institutions of white supremacy that have previously been more invisible are now getting identified. So thanks again. But I couldn't help thinking of that.
Thank you. No, thank you. Thank you so much for this. And again, this is something, I really think, it was interesting. I was writing, just kind of what made me start to really think about this is I was actually writing the conclusion to the book that Bassam had mentioned during the pandemic. And I really went back to my field notes to kind of think about, because these discourses we've seen kind of heightened right during the pandemic, and particularly during what's been happening most recently in terms of Black Lives Matter and kind of decentering, white supremacy and things like that. And so, I have kind of two responses. I'm not sure if they're exactly exactly what you're looking for, but the one thing I really also, and I try to do in my work, is that I think about how these factors become, I'm particularly looking at healthcare, right? And we've now, I think this idea of systemic racism and the healthcare institution kind of, it's there, right? And so really thinking about, and one thing I try to do is also think about the very practical aspects. So I think about the patients that I saw and how physicians talked about their insurance coverage, right? Because we know not everyone has access to insurance coverage, and we can kind of trace historically as to who does and who doesn't, right? And we're seeing underrepresented groups, those who are migrants or immigrants, those who are of lower income, don't have access to, private healthcare insurance that many of us, do, particularly if you are, like myself. And so very fortunate and privileged in that way. And so those are some of the ways that I really kind of had to kind of push myself to think about more about how these, and to see it's not just about, something I really think about was like, it's not just about religion, right? Like there's all of these other institutionalized practices that come into play that then kind of tie on or are together. And so I like thinking about how these kind of intersections and this idea of anti-Muslim racism, because it was this idea, it's this framework of thinking about how it is systemic, how it has become institutionalized different ways. But because we know, and we see here in your work and everywhere, that Muslims are extremely diverse in every sense of the word, and in terms of living and how they identify. And so, that's something I kind of grapple with. But what I went back to is, rather than looking at the individuals, is then to look at how the institution is set up. So one great example is that comes to my mind is thinking about this in my last chapter. I opened with a vignette about a NICU patient, and I was not able to observe NICU patients because of ethical concerns. But it was about a Muslim family who had come from Central Asia. They arrived during her third trimester. She did not have access to healthcare in her home country, so they didn't know that the baby had several congenital disorders and was really only going to live maybe a few days after birth. And so she delivered the baby via C-section at the hospital. She was a patient for the required time, and then she was discharged. And so her husband would visit the baby as much as he could in the NICU, and then she went to visit. When they stopped coming to the NICU, which is not uncommon. I mean, we think about being, having a child in the NICU. It's a very emotional, it's a very intense experience, particularly if you have older children at home, right? It's okay. Some people leave, and I witnessed that as well, as like some parents left to come back. When they stopped attending, the conversation among the NICU staff went right to religion. It went right to Islam. It was right about, is it something about the religion why they're not coming? Is it something, do they not want to care for this dying child? And I had not experienced that in any of the other discussions that I've heard about NICU patients who were non-Muslim. I had never experienced that. It was always kind of this, we really feel for the parents and things like that. And now it was blame. And what came out afterwards, after the parents returned, and I titled the conclusion, "The Important Case of a Bus," because the medical director announced at a meeting, she was the one of the care team I was working with, she was one who was seeing the patient, is that it had nothing to do with Islam. It was that they didn't know how to use public transit to get back to the hospital. And so that was the reason why they didn't come. And as she said, I love the quote, she goes, "It was just about a bus." And so these are not just these, I can't, I can't say it's just these individual biases, right? We've had that discussion. Now it's kind of dismantling these institutions and looking at it, how it plays out in these different institutions and organizations. And so, but I don't think I can do that alone without adopting some of these frameworks of analyzing racism come to be. And so this is really, really see the two. To be honest, I don't think there's literature out there that equates as, yes, Islamophobia is a form of racism. They're saying, no, it's not a form of racism and it has to be genocide. I don't particularly have an answer right now, right? Maybe that's something I can think of a bit more. But I do appreciate this idea, because I think what I want to try to do is, I'm kind of thinking about this more, is that what are these institutional places where we see Islamophobia, but it may not be coming out as such, right? Like it may take on different forms as well. And so I think that's what's really important to note. So I'll stop there. I just think that example kind of maybe speaks a little bit to you kind of decentering this, and people have noted, kind of thinking about the census, right? Is that, the idea of of a Middle Eastern category, right? Like, how do you identify it? It's not part of the census. Well, most will identify as white, but white is a very marked, right? It's not free of history, or it's a construct in itself, right? So also thinking about that in terms of my work. So I hope that answers a little bit of your
No,
question.
that was wonderful.
Not
Thank
going to
you.
there, but yeah, but that story of the child, the baby, the infant, really sticks with me as a way where this, maybe I kind of take along the lines of Paul Farmer and Seth Holmes, who look at structural competency and
Yeah.
not cultural competency. I think that could maybe be another way that we could start to think about it in terms.
Thank you,
That's helpful. Thank
Chris.
you.
Thank you, Chris, and thanks, Courtney, for your thorough answer. Um, I will now move to two more questions that we got, and I am also going to open things for people who would like to ask directly. But I'll start with the questions that we received through the chat, and I do see that We have someone, I don't have a name, but someone is appearing on video. Would you like to ask a question? uh Maybe third after I pose the first two. Okay, so okay, Stephen Harris Scott. Okay, Stephen, you have a question on the chat. Would you like to deliver it live, because it's
Sure.
COVID?
Yeah. Yeah, I was just, I felt like typing it out and then, but I can of course ask it.
Yes.
Hi.
Hi.
So my question is essentially about Muslim Americans
Mm.
and whether you've read anything or saw anything about whether the infection rates are actually lower, higher, average. We've heard a fair amount about African Americans being, very
Yeah.
affected. But at least I haven't seen anything about Muslim Americans. And as you know, I read a lot about probably way too much
Yeah.
about COVID. It's all research and it's all for scholarship, I'm sure. But yeah, just wondering if you had seen anything, both because of I wonder too, because certainly when I saw my own students and with full face coverings right at the beginning, as we're going into the pandemic, I was kind of thinking like, oh, I wonder if they're going to be kind of better off, anybody already kind of in a culture with a face covering. That seemed to be a good defense. Now, again, I don't really know about the science enough to know, like, is exactly the material they're using for that actually good or not for the, so that's
Yeah.
an interesting question too. But yeah, just wondering if you had any info on that.
No, that's really, I mean, I think part of your question actually gets to the like heart of my question.
Mm-hmm.
Is that right? We see data on Latinx communities, for instance. We see data on African Americans, right? And in the previous series, there was talk about Black Muslims in the U.S. and it disproportionately affected. And so, yeah, I can't give a definitive answer, because I think when Islam is not, it's a religion, right? It's not a race, but then it carries kind of how it's framed, kind of carries, this is why I'm thinking about this, this analytical framework of racism, right? Because how it kind of carries this markedness, right? Mm-hmm. And so, and markedness particularly in thinking about physical appearance. And so I can't, I would be appreciative if there is statistics out there. I have not seen, but I can't say that maybe I've missed them in my research to do. But I think what you're actually getting at is really important, because we see Muslim Americans, I mean, all identifying in various different ways in terms of race. And so it's interesting to think like, would we hear this if we're thinking about like Christian Americans? Like, would they be asking like, oh, how is the Christian, how are Christians affected by COVID-19, right? And so like, I love this question, because that really makes us think about these different frameworks that we're operating in. And so, when I go back to Lila Abelugo's article where she was talking about being interviewed and they were asking about like, do Muslim women do X? Do Muslim women do Y? And she's like, substitute Christian or Jewish and do those sentences make sense, right? And the answer is kind of, the interviewer didn't respond, kind of just like glossed over and continued on to the next question, right? So I think you're actually getting at kind of the heart of how we are thinking about what might be called in the literature of kind of seen like this Muslimness, right? Is that it really cuts across these different frameworks as well. So I think that's a really interesting question. I mean, we have seen some, particularly thinking about news media and such about particular Jewish communities. I'm thinking about like in New York City, for instance, and COVID-19. But I would be much appreciative if people have any really good sources as to data on this. Yes. So
yeah, because I assume it's not like a reported, it's not a reporting thing that at least I remember that big discussion at the beginning of we didn't have access to like African American data and that kind of stuff right at the beginning. It was a bit of a controversy, if I remember. And that seems like
absolutely.
I don't fully remember, but
right.
But they would report that, and that would be sort of a reporting mechanism, whereas they're not going to necessarily.
Exactly. I mean, because it's thinking about here too, right? Like I'm just thinking about Fairfax County data, and we're seeing particularly looking at Latinx as being disproportionately affected here in the Fairfax County. I can't speak to all over, different parts of the US, but if we're looking at Fairfax County, if you look at the COVID-19 data, historically, although I haven't looked, in this last week or so, Latinx has been quite disproportionately affected. And we have to think about, there's been several discussions as to why. Is it multi-generational households, which might be of cultural importance, but also out of economic need? Is it being essential workers, right? And that we're not particularly protected because they may not have time off, right? So there's all of these others, but it's not going down particularly to, I don't think we can boil this down to race. Like, we need to boil this down to these structural and institutional factors that we even experience here in the US as well. So I think you asked a really great question. I'm sorry, I can't exactly give an answer, but I think like that's the question that I want to ask, right? Like, how can we use those frameworks? So yes. Yes, thank you, Steve.
Thank you, Steve, and thanks again, Courtney, for your thoughtful answers. I will now move to Yasmin's question. Dr. Yasmin Ipek, who is also at the at Global Affairs here at GMU. I tried to pressure her to pose the question live. I failed.
Okay, not a problem at all.
She says this was great, which is a compliment. Thank you.
Yes,
and
thank you,
thank you
for being here.
So she's asking, I'm curious, she says, about which Muslim communities in the US are more active and vocal on social media. I see differences based on generation.
Oh, interesting.
Are there any other criteria that shape Muslim participation in social media in the US?
That's really interesting. That is a really packed question there. And one I can't speak to all. So I will speak particularly to the tweets that I was looking at. And I have to say that something I want to get into more in terms of my methodology is like a Twitter analysis. I've never particularly done it. So I went through these tweets by hand. So it's not exactly the most accurate representation of responses and retweets and such like that. So I'm going to put that caveat out there. But it was interesting. I did see in terms of the no problem, Yasmin. I did see it in terms of generation as well. I also, if you look through the responses, you could see it's from a wide variety of people too. I'm going to kind of go on a tangent for 1 second. It's also from people who are non-Muslim who identify as such. We saw the tweet about I'm an atheist, I'm agnostic, I am Christian. And so we see different, several different tweets. So if you look through that, I encourage you, to also take note of how people identify as they are responding. But I can't exactly say, because I have not done such a social media analysis, is thinking about generations. Yes, I do think that from what I have seen and from what the online kind of the textual analysis I did as part of the book, I have seen some of these younger generations kind of being more active on social media in terms of responding, in terms of also one thing I did as part of my book is I looked at message boards to Islamic scholars. And I did notice that those who were 20s, I would have to say, I mean, this would be my guess again, I'm estimating in terms of generation, were much more active than those who were older. They were the ones who were posing the most questions. Was kind of this younger generation. But I would have to say that to know which communities are more active, other than kind of the tweets in my own work that I've seen, I can't speak too much to giving a more definitive answer to it. The one thing I wanted to say, though, is even in the tweets to the response, I think back to Amira Jamarkhani's work on Arab womanhood, particularly how it veils, harems, and belly dancers, her book, is that a lot of times, unfortunately, particularly Muslim women on social media were explaining they spent so much time, as Amira Jamarkhani writes in her book, they spend so much time explaining the Orientalist caricatures that we don't get at their stories. And so that is something I did notice too, through some of these responses as well. So I can't speak with definitiveness as to which communities are more, other than what I have seen in my own research, which I do agree that I have seen generational, particularly those who are of immigrant parents as well. I have seen, particularly in the message boards. And that was interesting because there were imams who had talked about how children might stray from the faith, but then once their parents start to become very ill or sick, they come back to it. And so maybe that is a why I saw more questions being posed by people who were in their 20s and 30s, who were either born here in the US or who had immigrated when they were young as well. So that was in my own work. I can speak to some of those communities and populations.
Thank you, Courtney.
Thank you.
At this point, and of course, thanks to Yasmin for posing the question and for sending me a smiley face. Um, So at this point, I am actually first of all, I'm really excited that everybody is hanging around, and unfortunately, we lost one person, which makes the 20 squares or rectangles less than perfect on my screen because it was perfect with 20 people. So if somebody can join, that'll be really nice for that purpose. All right, so I'm trying to stall here so we can get more questions. We have a fantastic, thoughtful, and I might say very intelligent scholar with us. So this is an opportunity to take advantage of this and engage with Dr. Rinker. Are there any questions anybody would like to ask? If there isn't, I might want to ask Dr. Courtney to sort of make a few closing words
Sure, I'd love to.
that would sort of distill some of what has been addressed and kind of you know, make us look forward a bit
Oh,
to something, including this question of, you know, Muslim Americans and African Americans and
yes,
the sort of the conflation, or maybe I should say conflation in quotation marks, between Islamophobia and racism,
right.
because we have also um, encountered this in so many other fields. I was just arguing with
Right.
like discussing with a few people, including my own partner, uh issues of sect back home, like in the
Mm,
region, where
right.
one sect is considered dominant in a particular country, and they have actually been using that power to dominate, and whether this can be um understood as racism as well. And I mean, it was an interesting discussion.
Yeah,
Yes,
that is.
if there is a question by
Yeah, there's
Alexandra
one more
Argot.
question
So
before I close.
this is
Yes.
awesome. This is awesome. So Alexandra, would you be able to? All right.
Yeah.
Would
Hi.
you be able to pose it? Okay, great. I guess the stalling tactic worked.
Hi. I really like the presentation. It was awesome. I just have a quick question. What's your opinion? Well, during the summer, I read a lot about India's. I mean, it's international. How they call the corona hijab, and
Yeah.
have so much hatred towards Muslims,
Yeah.
and how they kind of blamed coronavirus on
Yeah.
Muslims. Thank you.
Yes. Yes, I did see that. I did not include some of the images. This has been when I was starting to think about this and delve into it a little bit further. This was one of the, several news stories had come up. There are several images, such as the coronavirus dressed in kind of what we might think of as like Muslim, kind of traditional Muslim attire, however you want to define that. And so there were some of the images which I just chose not to include because I found them actually to be extremely offensive. Yes, and also, I want to think about this. I'm talking, what I've delved into is these ideas, particularly in what we're seeing kind of happening in Europe, what we're seeing happening in the U.S. I referenced New Zealand a little bit, but we also have to think about some of the other countries, like Bassam was saying about sect, right? But what's happening in Myanmar, for instance, right? With and different places around the world. And so I also think that's also that's very important to consider as well. But yes, that was certainly part of the kind of analysis and what I came across, and what I was thinking about is that how the coronavirus also kind of embodies some of the bigger political struggles as well. And we're seeing that, I think, perhaps in India, which is also injustices, and we can think about human rights and social justice, for instance, in those cases. But yes, that was there were several images, and if you do, I'm sure you've seen, like if you go online, there's several of blaming. But is this really, people talk about kind of, and I'm gonna go back to my first slide in the zombie in the literature and in anthropology. Think about the zombie. People talk about the rise of the zombie and also the rise of witchcraft in times of transition. So we'll see witchcraft accusations, for instance, historically have come about more so in a time of societal change. And so we also think about, I'm thinking like the work on the zombie in South Africa, linking to capitalism, linking to apartheid. And so we see these rises. So you could think about the coronavirus, kind of, the zombie being the attacker and the coronavirus um, is with also thinking about maybe the coronavirus is also kind of the, we're seeing heightened, kind of this is kind of also bringing out the frustration. Maybe it's the process in reverse, right? As to and maybe that's what we're seeing in India, for instance. Absolutely. Yeah, you're right. I think, oh, okay. And then Chris said, thank you very much, Chris, about the work of the zombie and colonial writings and such like that. And so, yes, trying to kind of tie it back to that as well, that there's this long history involved. And so maybe like with the coronavirus, we're also seeing kind of these politics and these histories also kind of being manifested as well, coming out on different policies and practices. So I think I'll close, Bassam. Is that right? A few words. So I
If
just
you
want
don't
to
mind.
say, yeah, absolutely. So I want to thank everyone for coming and for listening, for helping me think through this. Again, this is something that's kind of tangential and has come up, particularly in the last couple of months as I was finishing the book. And so I also want to say that I hope just some of the things one thing that I've thought about a lot is my own in my writing is my own identity, right? And what I can do in my role, in my place in the institution and in society. And so, but also thinking about how these different points intersect. So as Bassam said, that this plays out in so many different ways. And to also kind of think about how we can, as scholars, as academics, as researchers, however we can make kind of an intervention in this. I think, as Imam Mahmoud said, to stop hurting each other and to show each other grace and peace. And so that might need to, I mean, of course, there's some long histories and political struggles there, of course. But that's something that maybe we can do too as scholars, particularly in this living in this pandemic. So
Thank you so much,
thank you.
Dr. Rinker, and thanks to everyone for joining us. I have the flyer behind me here and on the other TV. I thought I would do that, and it took me half an hour to adjust the brightness because it was too bright. I hope you can see it. Before I leave you, I just want to say again, thank you so much to this fantastic presentation, Dr. Courtney Rinker, and I hope that you will join us also next time on November 4th. I just shared with you the link, so you can click now and save it in your inbox or calendar. And this is another really, really successful presentation in the series on COVID-19 and how Muslim communities are coping. Hope to see you all again. And in the meantime, stay safe. And as I keep saying, stay together because I believe in this. Thank you all so much.
Thank
Thanks
you.
to and thanks to Aisha Noor
Yes,
for
thank you,
shepherding all of
Aisha
this.
Ahmed, for putting this together and to Bassam for facilitating.
Thank you.
Thank you.
Salam. Salam. Salam alaikum.